is Susi from Visual TV, and you all know October is a breast cancer awareness month. As part of breast cancer awareness, today we have Dr. Bhuvana Ramaswamy Garu. She is the breast cancer expert and oncologist in James. She is going to give some advices and information about the breast cancer awareness and as well as risk. Hi Bhuvana Garu, how are you?
Good, doing well, thank you. How are you, Sushi?
I'm good, thank you. Why would women need undergo screening?
I think that's a great question. I'm glad you asked that question because screening saves lives. Okay, and how is that? Because by doing screening, whether it's mammogram or other modalities, and most commonly mammogram, we are able to identify breast cancer early. Okay, so earlier stage breast cancer, and earlier stage breast cancers have higher cure rates. So for example, patients who are diagnosed with stage 1 or stage 2, which is earlier and the tumor is smaller, they have a chance of cure that's well over 90%. And these things keep dropping, and if someone is stage 4 breast cancer, the chances of cure goes way down. So it is so important to screen. By screening, you're able to diagnose breast cancer early, and because of that, you're able to treat them better and cure them of the breast cancer, and hence you save lives. So it's very important to screen.
Oh, thank you. When should women start to undergo screening?
In this country, an average risk woman, that is somebody who doesn't have a very strong family history, you don't know that you have some genes that you've inherited that is abnormal, so you don't have those risks, you have an average risk, you have to start undergoing screening from the age of 40. And after that, you undergo screening annually, that means once every year. Now, I mentioned to you with somebody with family history. Say someone has a very strong family history of breast cancer, multiple mom had, sisters had, and things like that. They need to talk to their doctors because they may need to undergo screening a bit earlier, and they may need to do some other testing called genetic testings and things like that. So, that's a separate group. But if you're average risk, no family history, then you need to start screening at the age of 40 annually, just every year, and you continue to do so until you're well.
Is mammogram the only way to screen, or any other ways to identify breast cancer?
That's another really good question. As well, there is new research coming along. I would say at this point, for us, the maximum data, the most amount of data we have is to do screening mammograms. Now, I do want to say the screening mammograms have evolved. Now we do something called a 3D mammogram, which is another word is called tomosynthesis. And these have a better way, can pick up even more smaller tumors. So we have what's called these 3D mammograms you could do. Now, occasionally I mentioned to you about patients who have very strong family history, or if they have a gene mutation, if they have extremely dense breast and things like that, they can undergo breast MRI too, also as an additional screening, not just as only screening, but those are only smaller population of patients. There's also newer things coming around about specific types of ultrasound that could be used as well in very dense breast, again as an additional tool to mammogram as well that you could use for screening. So there are different modalities. Primarily what women need to know is for sure they need to undergo screening mammogram from the age of 40, but if you have some additional risks, they should talk to their doctors again to see whether they need something more than a mammogram.
Oh. What are the factors that increases risk of the breast cancer in women?
Very good question, because that's how you reduce the risk, right? To understand what are the risks. Well, the first important thing you have to understand, the two most important risk factors are the fact that you're a woman and that you're getting older. So age and women, so two things you cannot change in your life. You're born and you're going to get older every day, so you can't change that. The other risk factor is family history, which is also something that you cannot modify. So if you have your mom had breast cancer or your sister had breast cancer, so your first degree relative, that increases your risk almost by double. So that's important to know. But there are other risk factors that are basically, if you understand what all happens to your body that increases exposure to estrogen. Okay? Estrogen is a female hormone, right? And estrogen makes the breast cancer, it kind of feeds breast cancer. So when your breast cell sees estrogen, they multiply a lot. So estrogen is very important factor for developing breast cancer. Okay, so what are the factors that could increase the exposure to estrogen? So somebody who could, had a late pregnancy or a very late menopause. So that means they had estrogenic exposure for a long time, right? So these are other factors to some extent that we cannot control. There is also data that if you breastfeed after pregnancy, then you can reduce the risk of breast cancer. So now the same estrogenic exposure that I mentioned to you is the use of postmenopausal hormonal therapy, right? So again, more exposure to estrogen. So you go into menopause and you take hormonal therapy to prevent menopausal symptoms, that can increase the risk of developing breast cancer. Okay, so some of these are modifiable, so you can think about it. Do you really need to take hormone replacement therapy? Look at the pros and cons. Discuss that with your doctor. Okay, there are few other very important aspects that you and I can do to reduce our risk. Okay, that would be obesity. Okay, so postmenopausal obesity particularly, or also getting obese as you get into menopause, getting bigger as you get into that 50, 55 and beyond that increases the risk of breast cancer. So again, lack of physical activity, obesity, the diet, it is important as well, and higher alcohol intake can also increase the risk. So if you ask me what can I do to modify my risk, right? Because you can't change, you're a woman, you're getting older, you can't change family history. Perhaps you can think about whether you need to take hormone replacement therapy or not, that is one. But most importantly, eat right, exercise, avoid obesity, and moderate your alcohol intake. I think that these are the things that you can at least do to reduce your risk.
That's awesome solutions. Thank you. How many types of breast cancers is there?
Good question again. So I think when you talk about breast cancer, we have to understand two things. One is called a non-invasive cancer. That's often also called a stage 0 or ductal carcinoma in situ. Big names, but what that means is it's a very early stage cancer that hasn't really become invasive yet. Okay, that stage 0 cancers are 100% curable. Okay, but once that stage is done, then we have what's called invasive breast cancers that can range from stage 1 to stage 4. Within that group, we have at least 3 to 4 different subtypes of breast cancer. So the question that you asked is very important, because breast cancer is not all in one bag anymore. Okay, it's not in one basket. There are different subtypes, and the patients perform differently. The treatments are different. So it is important to understand that that breast cancer are not all the same. If you so happen to have the bad luck of having developed breast cancer, you should understand what's the subtype of your breast cancer and how is that divided. Primarily, if you think about it, I already talked to you about how estrogen, cancer cells, breast cancer cells often feed on estrogen. So we have a group of subtype of breast cancer that are estrogen receptor positive. And then you have another subtype of breast cancer that are not positive for hormone receptors. Okay, and then there is a third protein that we check on breast cancer. It's called HER2. Again, do not remember these names, but these are different proteins that helps us understand if you have that HER2 protein, then we have very specific treatment against that HER2 protein. So we can use that. So there are these kind of different subtypes. It dictates what treatment we use, and it can also affect the prognosis of how well they do.
If somebody feels lump in their breast, what they should do?
I think that's a very important question again, because time is an important factor. So if you feel a lump, the first thing that you should think is take a deep breath and say, hey, it may not be cancer. Okay, so don't panic right away. It could be anything else. You can have benign tumors, that is non-cancerous lumps in your breast. So don't panic right away. It may not be cancer. But, this is an important but, don't ignore it. Don't think, why should I get cancer? I don't have any family history, because I see this a lot. My patients would say, I felt a lump 6 months ago or a year ago, but I thought, doctor, I know what, I've never had, no one in my family has had breast cancer. So 85% of the patients diagnosed with breast cancer will have no family history. So don't think it's nothing. And let me wait and watch. So if you feel a lump that you did not feel before, don't panic, but seek attention. You could call your primary care doctor. That would be the best place to start. If you have a gynecologist, you could call. If you don't have any doctor, then make sure you find a doctor that you can go and see. Someone needs to examine you, and then make sure you get the right management after that, which will include imaging, mammogram, ultrasound, may need a biopsy. Okay, so those will be the next steps. But what is important is to seek attention from a provider.
No panic.
No panic.
Have been in many years from this breast cancer research and treatment. How do you feel and how you excited about this research? Is there any changes happened so far, and can you please explain a little bit?
Absolutely, it's been so exciting. There has been so many changes, and the most important things are we are diagnosing breast cancer early, okay? And when we diagnose breast cancer early, we are doing less surgery. What does that mean? We used to take out the breast, take out everything, mastectomy and all of that. Now we can do smaller and smaller surgeries. We give less radiation, but better outcomes. We also do less chemotherapy now than when I used to start working with this, and better outcomes. So we are having newer and newer treatments that are more targeted and more personalized, that they have less toxicity but better cure rates. Okay, so diagnosing early, less toxic treatments, less toxic surgeries, better cure rates. So it has been an absolutely exciting journey that I've been part of. And what excites me for the future, we are getting into the nitty-gritty of the cancer now. So we're getting into really understanding the small changes in the cancer and doing really personalized, tailored treatment. So I really am excited to go to that next level where we're really giving those personalized therapy. You could ask me maybe what is still something that is a challenge. I really would like to see less number of cancers diagnosed. I want to see prevention. I'd like to see we are actually not having this cancer, right? It's okay to cure, but what if we don't even get the cancer? That would be better. So that's where I feel we should get better and better, and I hope that is also the next 10 years we see a big change in that.
For the best.
Yes.
Thank you so much, Bhuvana Garu, for your time and all the information. And any final message for our viewers, any tip?
Absolutely. 3 things: eat right, exercise, and get your mammograms.
I'll do that.